Hello there, my name is Roopa Pai. I write for children. I've been writing for children for a very long time, and I have a bunch of books out, including books like What If the Earth Stopped Spinning and 24 Other Mysteries of Science. This is a pop science book. I have So You Want to Know About Economics, which is like a little primer for anyone who wants to know about economics, children or adults, but essentially for children. There is also this book, The Gita for Children, which is self-explanatory. The title is also The Vedas and Upanishads for children. I also have a book for teenagers, which is a great one to use right now, actually, since they are at home. And if you have nothing to do, it is 99 must-have skills for the world-conquering teenager. It's called Ready, and it's inspired by Baden-Powell's Scouts and Guides movements, and it's got a bunch of challenges inside that children can test themselves with, and then they win badges. Just like we used to in the Scouts and Guides, there are badges like these that they can win. There's also another one of my new books is this, From Leeches to Slug Glue, 25 Explosive Ideas That Made and Are Making Modern Medicine. And then I have to prop this phone against these books, my absolute favorite babies, Tara Knots, which was actually India's first fantasy adventure series for children. There are 8 books in it, and they're super fun series. So there's that. And most recently, I worked with Milind Soman to, supermodel, fitness evangelist, amazing all-round person, to write his memoir, which is called Made in India. So why I am on a video today with you is because I saw the Google Doodle today, and it's a doodle in honor of a man called Ignaz Semmelweis, a doctor from Hungary who used to work in Austria and made his biggest breakthroughs there. He was a hand-washing evangelist. He was the very first person recorded in the world who said, maybe if surgeons wash their hands, we would not have so many deaths of young mothers in the labor wards right after childbirth. I mean, that was a revolutionary concept. People hadn't thought of that. Oh, wash hands, but why? We have noble hands. How dare you suggest that they're dirty? And why was this so unusual? Because nobody had figured out that germs cause disease. In fact, that connection that germs cause disease was made only by Louis Pasteur very recently. I mean, less than 150 years ago. About 150 years ago. Less than 150 years ago. Yeah. So I saw this Google Doodle and talked about Ignace Semmelweis, and often I don't know who's being talked about in the Google Doodle. I'll have to go research them. But this guy was like my old friend, Ignace Semmelweis, because I've dedicated an entire chapter to him in this book, which is like 25 explosive ideas from the history of modern medicine, 2,500 years of medicine until it reached the stage we are at right now. So, of course, this book starts with the oldest systems of medicine, including Ayurveda, of which we are all big fans, of course. But it also talks about modern medicine and all the breakthroughs that have happened in the last 150 years and more. And why did I write this book? Why did I choose to write about a topic as obscure as medicine for children? Well, because, I had no idea that such a huge pandemic would hit us so soon after this book came out, and that this book would be relevant in that way just because it has a lot of information about about the history of medicine. But I wrote this book because about a year ago, medicine and doctors and hospitals, I realized, had begun to lose their sheen very, very badly. People didn't trust doctors, people didn't trust hospitals, people did not trust modern medicine. And I felt, hey guys, just hang on a minute. We are throwing the baby out with the bathwater if we're going to diss modern medicine like this, because although it's a very new science, it has ensured that we live longer, more disease-free and more pain-free lives in the 21st century than in several centuries before this. So I felt like maybe we should show some gratitude to all the curious and never say die minds who at the cost of great personal discomfort and personal struggle performed so many sacrifices to let us see the truth. So this is a book celebrating doctors, and so soon after that, here we are again in March 2020 celebrating doctors again, bowing down to healthcare workers, saying thank you so much for doing what you do. What would we do without you? Right? So and I saw this Google Doodle and I said, maybe people want to know about Ignace Semmelweis, because I enjoyed writing about him and researching him. It was a revelation to me. I had no idea who this man was until I started my research, and I loved what I found out. So I just want to read you that little bit so that I think you will find it interesting too, and this whole history of hand washing itself. Okay, so I start with a visualization exercise saying if you were going in for a surgery in the 19th century even, this is what you would probably have to go through. So it's just this visualization exercise. So how was it? So maybe you can close your eyes and listen and imagine this as I read. So how was a typical surgery conducted in the 19th century? Here's a visualization exercise for you. An operation theatre scenario from, say, 1850. Brace yourself and try to make it through without screaming. You are lying on a raised flat surface in the center of the room, waiting for your operation to begin. The surgeon walks in, straight in from the street, without even pausing to take off his work clothes. From a hook, he takes down his surgical apron, still stained and smudged with the blood and pus of a bunch of previous surgeries, and puts it on with a sense of great pride, joking about good old hospital stink. As he gets ready to give you the anesthetic, he apologizes for coming in late, saying he was, sorry, I was held up at the mortuary, where he has just finished performing a dissection. The anesthetic takes over and you pass out. When you come to, your friend, who has watched the surgery in the same room, tells you that the surgeon did a great job. Sure, he says, he dropped his scalpel a couple of times, but he just picked it up, wiped it on his apron, and carried on like a trooper. When he had to use both his hands for something, the surgeon calmly held his scalpel between his teeth. And it was really cool to watch how he picked the little suture threads right off the eyelets on his battle-scarred apron and used them to stitch you up. It was all a one-man operation, and your surgeon, he says, totally rocked it. After the surgery, the windows are open to let the fresh air in so that the miasma from the wounds is carried away. So here I have to give you a little heads up. At that time, people thought that it was miasma that caused disease, not germs. And it took Louis Pasteur in the late 1800s to finally make the connection between germs and disease. But until then, for a long time, people thought it was miasma. And what is miasma? Just foggy, stinky air which rises from decomposing animal parts, decomposing plant parts. So they thought after the surgery, just open the windows, the miasma will go out and he'll be fine. And they were all often very puzzled about why the patient died after a surgery like this. Right? End of visualization exercise. Let's pause for a moment to get your breathing back to normal. And to give thanks that we live in the 21st century. Never mind the coronavirus. We are still very, very lucky to live here in this age. Right. Astoundingly, until very recently, this was how things worked in the operating rooms of the best hospitals in the world. Surgeons were just as much at risk as patients, which is why even they recommended surgery only as a last resort. There was even a move to abolish surgery from hospitals altogether. So terrible and fatal and common were the infections that followed them. Now, luckily for all of us, here we're coming to our hero of the day, there were some physicians who questioned the status quo. One of them was a Hungarian obstetrician called Ignaz Semmelweis. And what's an obstetrician? Somebody who handles childbirth, who helps in deliveries. Where am I? One of them was a Hungarian obstetrician called Ignace Semmelweis, who was losing his mind over the extraordinary number of young mothers who died during or soon after childbirth from a deadly infection called puerperal fever or childbed fever, or childbed fever. In the Vienna General Hospital where he worked, the rate of mortality from puerperal fever, what does rate of mortality mean? The percentage of new mothers who died from the disease was about 10%. That means for every 100 mothers who delivered, 10 definitely died. That's a higher percentage of fatalities than the coronavirus. And this was from doing nothing more dangerous than having a child. Okay? This in itself wasn't worrying. Imagine that, 10% wasn't worrying because it was close to the average maternal mortality rate, or MMR, let's call it MMR. That is the percentage of mums who died soon after childbirth. Close to the average MMR across Europe. So 10% was average. But there was one particular statistic at Vienna General that troubled Ignaz Semmelweis no end. And what was it? The hospital had two maternity clinics. One was called the first clinic, where Semmelweis worked with other doctors, means they had had a lot of education and they were very white collar. And the second clinic, which was staffed mainly by midwives. Who are midwives? They don't have the education or the technical knowledge, but they know how to help a new mom have her baby. Okay. They've been trained because of numbers of deliveries they have done. So they don't have the education part, but they are trusted a lot. And in those days, definitely. So there was the first clinic which was staffed by doctors, and second clinic was staffed by midwives. Both of them were free clinics at the Vienna General Hospital, and they had been set up to take care of the babies of poor women who could not afford to do it themselves. So they told poor women, if you can't take care of your babies and you've gotten yourself pregnant, just come into the hospital, we will deliver your baby and you can walk out a free person, we will take care of your baby as well. Now, why would anyone do that for these women? In return, the women agreed to have their babies at the hospital, allowing doctors and midwives to get training and practice in obstetrics. Okay? So, the statistic that so bothered Semmelweis was this. While the first clinic's MMR was 10%, the second clinic's was less than 4%. So the educated doctors were killing off a lot more new moms than the midwives. And that really troubled him, it really hurt his pride. Expectant mothers begged to be admitted to the second clinic, even preferring to have their babies in the street rather than being admitted as hospice patients in the first clinic. And so would you, right? I mean, if the MMR was so high, if the rate of death was so high in the first clinic, why would you want to be admitted there? Even if they said, we'll take care of your babies afterwards. The astounding thing was that the MMR, even among the street births, even if they had their babies on the street, that the number of women who died was lower than if they had their babies at the first clinic. Feeling personally humiliated, Semmelweis grew determined to get to the bottom of the mystery. To begin with, he studied the workings of the second clinic closely and replicated everything that was done there at the first clinic. But the MMR did not change. Semmelweis realized that the only thing that was different between the two clinics was the staff. It was doctors at the first, midwives at the second. But he could not for the life of him figure out how that made a difference. Until 1847, when his fellow doctor, Jacob Kolechka, died from an infected wound. The wound had been caused by a student accidentally poking him with a scalpel during the post-mortem examination of a patient who had died of puerperal fever. Means a young woman had died right after giving birth to her child from this horrible infection called puerperal fever. So the body had been taken to the mortuary and a post-mortem was being conducted to see how the organs look, what could be the cause, and he was in the middle of that when a student who was also cutting up the body and doing the dissection, his scalpel went into Semmelweis's arm, and that wound got infected and Jacob Kolechka died. So he said, hey, what is this? How did this happen? So the wound had been caused by a student accidentally poking him with a scalpel during the post-mortem examination of a patient who had died of puerperal fever. When Kolechka's own autopsy means after death when you open it up to see what was wrong, When Kolechka's own autopsy was done, the report showed Semmelweis that his infection was remarkably similar to puerperal fever. And Semmelweis was like, hold on, I thought puerperal fever was only found in women, and that too women who have just delivered. My colleague is a man. He has not had a baby. How come he has the symptoms of puerperal fever? The penny dropped. The fever had been transferred from the cadaver, that is the dead body, to Kolechka via the scalpel. That was the difference between the staff of the two clinics. Doctors who attended childbirths also worked on cadavers, while midwives went nowhere near the mortuary. Clearly, doctors brought cadaverous infectious cadaverous particles from the mortuary to the labor room on their hands. There was no way Semmelweis could stop doctors from working on cadavers. It was part of their training. But what if, he said, what if they washed their hands in between dissecting cadavers and attending on living, breathing mothers-to-be? What a revolutionary idea. Maybe when you come from the mortuary to the labor room, maybe you consider washing your hands. I mean, it seems like so shocking, such a no-brainer to us now. But this was actually the situation, right? So he said, what about washing your hands? Maybe washing with a solution of chlorinated lime, which is the main ingredient of bleaching powder, might help. It certainly got the awful smell of rotting flesh off the hands. You know, when the surgeons went home, they washed with that only at the end of the day because it got the smell off their hands. So perhaps the same solution would also destroy the cadaverous particles. It couldn't hurt to try. Semmelweis worked feverishly to make the new routine of hand washing mandatory for doctors at the first clinic. He introduced it in mid-May 1847 and then held his breath, hoping for the best. The results, when they came, were far more dramatic than he could have anticipated. The first clinic's MMR in April 1847 had been an unusually high 18.3%. Almost 19 out of every 100 mothers there had died. In June, the first full month of hand washing, it had dropped by 90% to 2.2%. In July, it fell further to 1.2% and kept falling. In August 1847, the first clinic at Vienna General reported an MMR of 0%. Having a baby was no longer a life-threatening exercise. For the first time in history, not a single mother had died in childbirth for a whole month. Ignaz Semmelweis, our hero. Go look him up on the Google Doodle and also, do some more research about him and say thanks to him. And wash your hands, people. Stay safe. Stay in and stay safe. Bye for now. See you soon.